So I think when working in these scenarios about discontinuing some degree of respiratory support, whether that's through a tracheostomy or non-invasive ventilation, and seeing how the child does off of that support without the intention of restarting it. So seeing whether or not they are able to survive without that degree of support, or if this naturally leads to the end of their life. A couple of important points to make at that point. So one, we never stop providing care. That is something that we never do. We always will continue to provide intensive care for that child and for that family in the same way we had been providing it up through whenever that time comes. The way that care is shown may change. It may be even more so very focused on pain and symptom management and opportunities for the family to be together with the child, but we always are providing that care. I think when another point of how do we come to that actual decision around with a family of when to try off of that degree of respiratory support is certainly a challenging one. Something I continue to be saying today is that these are very challenging scenarios. I think often the things that facilitate this happening easier are, again, having a degree of trust between the family and the providers and the clinicians that are there, where there's a mutual understanding and shared understanding of goals, where the family trusts that the providers and the clinicians are going to help guide them through this really important part of their life, while also respecting the agency and autonomy of the families to have it be most in line with how they would want this to move forward. And every family is different. Some will say, we want to do it this time, this place, right now. Some don't want to be the ones to make that decision. And so that's where it's really the job of the team alongside the family, as they've already been doing up to this point, to come to decisions to figure out the best way forward in this now time of the child's life. It's interesting because it can sometimes go both ways, right? Where families may benefit from a little bit more guidance, or maybe looking towards their clinicians for more guidance on how to do this. Most families have never experienced anything like this, while clinicians, unfortunately, we have. And so with that comes a responsibility for us to help families through this time in their lives.